My name is Edge Asangbedo, and I am Director of Partnerships for an organization called SimPrinks. And this,
Right. So what do we have here?
so what SimPrints do is we work with verify impacts basically to ensure that everybody who needs digital public goods gets access to it. So generally working in areas where people don't have a formal ID. So therefore it's like, how do you know that I'm the person who's received one dose and a second dose? So this particular project is looking at a project of maternal and child health in Ghana. And what we're doing is we're trialing two modalities in the eastern province of Ghana across 30 clinics. So in 15 other clinics, we're doing by finger recognition, and in 15, we're doing face biometric. And the difference is, sometimes to do with personal taste, is preference, maybe sometimes because it's the face doesn't necessarily recognize children, for instance. So that's tough.
Interesting.
So that's tougher. But what the technology does do is that it recognizes different ethnicities because, sometimes I stand at airports.
It's a big deal.
It is a big deal because sometimes I stand at airports and my face is not recognized, which is very frustrating. So it does recognize that. And the fingerprints technology, at the minute, our efficacy is taking it down to 9 months. So we do child biometrics up to 9 months. And we're trying to bring that even further down so that we can work on things like malaria vaccines and the malaria projects. So in these two modalities, the test is to see which one is going to be more acceptable in Ghana. In these particular clinics, and because that would then determine how we roll it out further across the country. So the early results are telling us that fingerprint is the one that is coming out on top.
Over facial recognition.
Facial recognition. Which one would have thought that maybe because of pandemic, contactless would be, something that is...
It's interesting.
But it is quite interesting. And our technology is developed for last mile usage. So therefore it can be dropped, humid weather conditions, worn fingerprints, where people have very worn fingerprints, it still recognizes it. So that is a brief synopsis.
Well, you did a great job. This is great, and I hope those who are following along are excited about this. So thank you for this great work, and people can learn more about it. It's SimPrints, but it's also in partnership with the Ministry of Health in Ghana. Okay. Well, we thank you for your time, and we hope you enjoy the rest of the conference. Okay. All right. What a great poster.